Over 2 years ago, pictures of TV host Kelly Osbourne surfaced, looking almost unrecognizable due to her 85-pound weight loss. She kept it real by revealing she had a gastric sleeve. Well, I, like Kelly, have always struggled with my weight. But what I didn't realize is that my choice to do what some may think as being extreme will also help to manage other medical conditions related to my fluctuating weight and stave off risk factors to my health like heart disease and stroke at the same time. So, what did I do? Well, I turned to my local surgeon and caring staff over at Southern New Hampshire Health Weight Management, located at 29 Northwest Boulevard in Nashua, New Hampshire. Now, no, this isn't a commercial. This is an informative piece to let you know what I'm doing. And because you may be struggling about this and feeling insecure and wondering what your options may be. Well, joining us, Dr. Rob Catania has been practicing bariatric surgery since 2007. Since then, he's performed over 1,500 bariatric procedures. His caring staff at Southern New Hampshire Weight Management include Megan DeSantis, who's really been incredible. She's the physician assistant. She's been holding my hand through every step of the way, not to mention the nutritionist, the behavioral health consultations that I've been receiving. And Tanya, yes, my girl at the front desk. Oh, she is amazing. She wanted me to do cartwheels outside the door when I got my date for the surgery, but I figured that might cause security just to topple me. So I said, no, I'll keep it cool. But so excited. They have all played a significant role into what will be a life-changing event that I'll be undergoing soon. You're watching Gail Scott Key's Entertainment Now with Christina Millsaps, and we are so honored to have joining us now General Surgeon Dr. Robert Catania. Dr. Catania, thank you so much for taking this time to join us.
Oh, no, Gail, thank you for having me. I'm really happy to be here and looking forward to the conversation.
Oh, you are wonderful. Dr. Catania, for some who may not know, you're not just a general surgeon in Nashua, New Hampshire, but you're affiliated with multiple hospitals, including Catholic Medical Center and Elliott in Manchester, New Hampshire, and you've been practicing for more than 20 years. What has been so inspiring for you to continue doing what you've been doing?
Well, I got into what I'm doing now in weight management sort of by accident. It wasn't something that I was interested in when I was in training, but I started to see the power of the operation and now the several operations that we have available, as well as some of the medications that we now have available and the change in patients' lives that it's able to create. And, the more you're able to help people and make them really realize their full potential, the more enjoyment you get out of work. And so I get up happy to go to work every single day because I really feel like people end up much better off at the end of the day after having weight loss, either surgery or weight loss medicine.
Well, it's very true because of apparently through the hand-picked staff, as I mentioned with Megan DeSantis, she really is just amazing. From the very start, I saw the video of you talking about what the procedure is going to be and the process, which we will get into. But the care about this is because it's a life-changing event and you have to be dedicated to it. And for some who may think if you go on your first appointment, you're going to walk out with a surgery date. No. It is a process. So you're like licking your chops. Why would you? Can you explain when you're doing that for some who may be eager to anticipate, they have to work for it and they may not realize that. And the goal is for what's going to be coming at the end of that tunnel, the surgery. Has it been designed that way for a reason? And what is the satisfaction that you've seen because of that process?
Yeah, so the process is designed to make sure that patients who choose to have surgery and then actually undergo surgery are going to be successful with surgery. There's a lot of education, as you will well attest, that goes into the patient experience before surgery, because surgery in itself isn't a cure for obesity, it's just a treatment. And so to be really successful in the long term, patients not only need to have surgery, but they need to make the lifestyle changes before and afterwards to carry on that success and really sustain the success. And so we start everybody with an education process. We work on your eating habits, things that you do well. We try to reinforce things that are less healthy. We try to get rid of those behaviors and replace them with healthier behaviors. And same thing when it comes to eating habits. There are some eating habits that some patients will have that can make it difficult to lose weight. And so we try to work on the eating habits as well. On top of that, there's a lot of education, as again, you can attest in terms of, the correct portion sizes you should be eating, the correct balance of calories from carbohydrates, from proteins, and from fats, the right nutritional supplements to be taking afterwards. And it's all designed so that patients will walk out of the operating room with all the tools they need in their tool belt to be successful for the rest of their lives.
Absolutely. And you absolutely can say that I have been doing it, because I'm so proud to say I have my certificate.
There you
Yay!
It's my certificate. So I'm super, super excited. And I've always considered myself someone who has been educated to some degree. I know that there's always changes when it comes to, different ways of eating, because I remember I have actually trained and taken step aerobics, and I've also done weight training. But sometimes, that can also fluctuate. But let's talk about, like you said, the plan of what to look forward to, because there are some different ways of the plans that are set up. So you have your initial meeting that you are talking with the physician assistant, which was with Megan, like I did. You also have to you're meeting with a registered dietitian who gave me a plethora of information, because I did not know that even with the supermarkets, that there is someone who can even help further, a dietitian, to talk to you about what you're even ordering, which is cool. Sure. How did this come about? Yeah, I didn't know that.
Yeah, so different. Well, in terms of the dietitian visit, probably that's the most valuable 1 hour I think you spend in the preoperative process. I've been doing weight loss medicine and weight loss surgery since 2007, and I still learn something every day from when I sit down and talk with our nutritionist. So even people who are pretty savvy, who stay up to date, reading current trends, understand diets and things of that nature, will learn something from a nutritionist. And so they will assess our patients' current diet. They'll talk about ways they can improve their diet. And then they provide them, as you mentioned, lots and lots of tools to go forward with. If you walk into Pat's office, Pat's our dietitian, you will walk out likely with about 40 pieces of paper in your hand, each one having information on some other program that you can
You mean
use.
this briefcase?
Yeah, exactly.
Oh my gosh.
And then, there are, for example, Hannaford in New Hampshire is the grocery store that employs nutritionists at many of their stores. They work, several hours a week, and they run tours through the store for patients and customers. And it gives people the opportunity to learn really firsthand as they're grabbing the products off the shelf. We all think we know what we're doing when it comes to reading labels until you sit down with somebody who really knows what they're doing and starts reading labels with you. And they're able to do nice things like, if you pick a product, they may be able to pick a complementary product that may be a little better for you that's right next to it on the shelf. And so they really give you practical advice that you can use, take home with you to make better choices in terms of meal planning and preparation.
Dan was laughing because I use Instacart. So he's like, no, you're going to have to go into the store, Gail. We're going to introduce you to the store.
Like you're going to school. Well, I think all of this is so interesting, because adjusting your diet and eating healthier and learning how to eat, establish good habits before the surgery is so key because of the surgery and maybe some weight issues. However, what are some of the other physical or health issues that this kind of surgery will help? Because I know people are thinking, oh, it's just for people who are overweight, but aren't there in fact several other things, several other issues that people are having that this could help. And of course, diet also helps anything that we have going on, right? Not just our weight, but other health issues that are with us. So what are some of those other issues that this surgery really helps to correct?
Yeah, so it's actually amazing. And I could go on for hours just talking about that one question. So I'll hit the highlights.
Okay.
Diabetes and obesity are intimately related. And diabetes, particularly type 2 diabetes or adult onset diabetes, improves in the vast majority of patients who undergo weight management surgery. Cholesterol issues improve. And so you typically see a dropping of triglyceride levels and an increase in HDL or good cholesterol levels after surgery. Believe it or not, blood pressure comes down for most people after surgery. Things that you wouldn't even expect to improve, like asthma, improves after surgery because belly fat takes up a lot of space that the lungs can normally use. And so by helping people lose some belly fat, they're able to actually open their lungs more, breathe better. So asthma improves. Certain cancers are associated with obesity. And so risk of cancer, particularly important for women, risk of breast cancer goes down with weight loss. And risk of endometrial cancer goes down with weight loss. But so do things like kidney cancer and colon cancer. We see improvements in venous stasis. So people who have problems with swelling in the legs, that will generally improve after weight loss. Arthritis gets better as there's less stress on the joints. People's joints work better. It's really common for us to see patients who are sent over by an orthopedic surgeon saying, the patient needs a knee replacement. Can you help them lose weight beforehand? We help them lose weight and the knee doesn't hurt anymore. So they don't actually need to go on and have the knee replacement. I could keep going on and on. There are so many things that improve. Oh, obstructive sleep apnea. Sorry, another big problem associated with obesity that tends to get better with weight loss.
This is fascinating. And believe me, we can, even though it's a half an hour, I'm even thinking, something, we can push this out, Dr. Catania. We're here for you. We're here for you because you're amazing. And, the success, it's a two-way partnership. It really is a partnership because it's not just what you're going to do for the patient, but it's what the patient has to do for themselves. Because in order for me to get the certificate that I did, you do have to have the new Try Health. And you're required to complete the online course. And what was strongly advised to me is even though they're short, like 5-minute little modules or videos, to take the time because I felt like I was back in science class, to make sure about learning about all of the different types of saturated fats and such. This was really an education that was very beneficial. Did you have part in also with the Try Health, this whole program online that everybody, who is going to be going for the surgery will participate in?
So every bariatric program in the country historically had their own educational program. And we all, since most bariatric surgeons, it's a fairly small community. So we follow a similar set of guidelines. We're all accredited by a similar organization. And so every program had its own way of educating patients. And I wish I would have come up with the concept, but another bariatric surgeon from Baltimore came up with the concept of like, if we're all doing the same thing anyway, why not have one resource that all patients can use? And so over the span of several years and consulting multiple different bariatric surgery practices, they designed that program. And it's really, it's made a very uniform set of educational standards for us all. So it's becoming more and more popular. It's also very cost effective. It used to be much more expensive for us to have in-person classes to teach our patients that. And it was also difficult for our patients to, make 6 classes an hour long each in the middle of the week. And so, yeah, the nice thing about NuTri is it lets you do it at home. At your own pace. You can go back and watch the videos over and over again if you'd like to. And it really, I feel very confident that my patients have the education that they need when they walk into the OR after completing that program.
I feel like I'll be walking out with my PhD when I'm
done. That's what we're hoping for.
This is wonderful. And of course, as we're breaking it down, so we've been talking about the nutrition, but now there's the behavioral health. because when we meet on that side, there's a lot of things that people don't realize. And in that session, it is very clear to let people know that your body is going to change and your mind can be in that stuck mode of still thinking, hey, I'm overweight, but your body is like, no, you're not. You're going down in size. So can you elaborate a little bit more about the behavioral part of session that the patients would be meeting with and why that's so important as a process for this?
Sure. Yeah. So one of the standards for weight management surgery, going back to the 90s, has been a behavioral health evaluation. And there's sort of many different reasons why we do this. Kind of first and foremost is making sure patients are safe to proceed with surgery. So patients tend to do best if they understand the material that we're teaching them. And so part of the behavioral health evaluation is to make sure that you're absorbing that knowledge and you're able to put it into practice. Part of it is to make sure that there's no outstanding behavioral health issues that might make it really hard for people to be successful. So, for example, if you were really very depressed for any of a number of reasons, it may make it hard for you to focus on the healthy changes you need to make. So we would want to, delay that surgery until the depression was under better control. Same thing with anxiety. We've had patients with schizophrenia. So as long as their behavioral health issues are well managed and they're able to, cognitively understand the teaching that they're giving, generally we try to offer weight loss surgery to anyone who we think can benefit from it. On the other hand, we try not to offer surgery to someone who may put themselves at risk. It's a stressful process. You're going to find out you've already gone through a lot of stress getting through that, but
yes,
through the education, but the surgery itself is stressful. And then the changes that you go through for the first couple of months after surgery are stressful too. And so we want to make sure people have good mechanisms to cope with stress. We want to make sure that they're not having issues with, depression or suicidality, for example, because some people can turn to, suicide as a solution to stress, and we don't ever want to see something like that happen. So that's another part of the evaluation. Then after surgery, as you mentioned, there's lots of changes that occur with your body, with your mind, with your interactions with other people. And it's not always easy for patients to deal with those changes. And so it's nice to have a resource for the patients to be able to reach out to. If, for example, things at work have changed, or things with their spouse have changed, or body image issues come up. As you said, a lot of times your mind doesn't keep up with your body. And so I just saw a patient in the office today who was saying that, every time he sees himself in the mirror, he can't recognize himself. He doesn't realize that that's him he's looking at, because he's so much different than what his brain perceives him to be. And so that sometimes is an adjustment that people need to make slowly. And it's helpful to have some kind of support to go through that transition so that none of it takes you by surprise, and so that you don't get yourself into maladaptive behaviors to cope with that, right? I've seen patients who are unable to eat, and eating was maybe something that made them happy in the past or really helped them relieve stress. And so they turn to something that's less healthy, online shopping, for example. So, some people will sort of transfer an addiction from food to something less healthy, gambling, shopping, alcohol. And so we want to be there to help those patients when they potentially start running into trouble so that we can get them back on the right path.
That's a great point that you brought up, because addiction is the replacement of one for the other. And if you don't recognize it, that's where you can run into trouble. So I appreciate you bringing that up. And I know for myself, I know my husband's probably got the ear to the door saying, yes, tell her to rip up the credit card. Tell her.
I've not, joking aside, I've seen people run up very big bills because, eating gives you a little release of dopamine and serotonin in the brain, especially if you're eating things like ice cream or cookies. And that makes you feel good for a moment. And spending money does that too. Winning money does that too. So I've seen people get into, I don't want to name retailers, but online shopping is very easy right now, right? So it's very easy to get onto your computer and run through a fair number of checkout lines So, having people have the tools to defend against that before surgery is beneficial.
You raise a good point. My brother used to tell me beforehand that it would take 15 minutes to get over, a desire for something, if you really wanted, a craving, if you will. And I used to set my clock for 15 minutes, and he said, do something else. And I would try very, very hard. But, even the alarm would go off and I was still doing it. So it's a matter of just, you're putting an investment in yourself now. And this is huge. And you and your caring staff, as I said, you have made it so possible. You've been transparent, which I totally loved. And now you're getting to the point of the surgery. And I love the fact that you also had a video in place for us, and you're very transparent because it says, okay, what are some of the risk procedure, that can go along with a procedure like this? Can we talk a little bit about that? Because I remember the first time in the video, naturally death could happen. We hope it doesn't. I'd like to say, but there are some other things that could happen. If patients are not as transparent about their health to you. So could we touch a little bit about that, about what are some of the risk factors of having such a procedure?
Sure. Yeah. So, it's a complicated surgical procedure. There are several surgeries, and we can get into the details of the different surgeries if you'd like to.
Yes, please.
But there are, several different operations that we commonly use to help people lose weight. All of those involve making alterations in the intestinal tract, right? So operating on the stomach, or sometimes the stomach and the intestines. And we're taking pieces out. In some cases, we're rearranging anatomy. In other cases, we're always cutting holes into the intestine. The intestine's obviously filled with lots and lots of bacteria. So when we do these operations, we have to do them in a way that prevents any of that intestinal contents from getting out. So leaks are the thing that we worry about most when it comes to surgery. Fortunately, particularly in the era of laparoscopic surgery, we have such a good view of the anatomy that we're working on, and we're able to test all of those hookups that we create, or the divisions that we create with staples or sutures. And so we can look very carefully for even very small leaks. And if they exist, fix them in real time so that they don't go on to cause a problem. That being said, there's still about a 1% leak rate after surgery for patients. Bleeding, anytime you operate on a patient, bleeding is always a potential hazard. And so we also are very able to control blood loss with laparoscopic surgery. Most patients these days, when they have a weight loss surgery, will lose a tablespoon or two of blood. It's really remarkable how little bleeding occurs. That being said, there's really, really big blood vessels in the neighborhood. And if you don't perform the surgery well, you can get into trouble really quickly. So bleeding is an issue. As you mentioned, death is a potential risk for any surgery. The good news about bariatric surgery is our risk of dying from a weight loss surgery is now about 0.1%, so about 1 in 1,000. That's actually safer than some of the surgeries that you would consider fairly routine, like having your gallbladder out, having a joint replacement. And so we've gotten very, very good at taking patients through the operation, partly because we do all the things that we do beforehand, right? And so we are very careful about screening our patients to make sure they have no outstanding diseases that aren't under control. If you do have, for example, high blood pressure or diabetes or heart disease, we're going to make sure it's really, really well controlled beforehand, so that when you go into surgery, you're going to come out in good shape. We are big believers in prehabilitation. So instead of trying to get you to build up your strength after surgery, we'll get patients to get in shape before surgery. Now, that's not applicable for everyone. For example, you didn't need to go through prehabilitation because you're in very good shape. But there are some of my patients who can't, walk up a flight of stairs. And if you're not well enough to climb a flight of stairs, you're probably not going to do well in surgery. So we'll put patients through rehab, or really physical therapy, I should say. So they'll work with therapists to build their strength, to build their stamina before they get to the operating room, so that if anything does go wrong in surgery, they have the capacity to weather that. The other kind of risks we talk about are hookup risks. So when we create the sleeve gastrectomy, or we create the gastric bypass, we're taking organs and changing their shape or changing their size. And so all those hookups have to be just right. If you make the sleeve or the gastric bypass too big, patients don't lose enough weight. If you make it too small, it's very hard for them to eat. They can lose too much weight, which we don't want. So we try to make sure we're very precise with those measurements that we're making during the procedure to prevent those kind of complications. And then, there are things that can happen down the road as well, particularly vitamin and mineral deficiencies. By altering the GI tract, we alter the way you absorb those vitamins and minerals. And so we want to make sure that patients have the tools they need to not run into vitamin deficiencies. And there are lots and lots of things that happen at 0.5% or 0.2%, so very, very small risk issues, but they're not small if they happen to you as a patient.
Right.
I think the most important thing you have to keep in mind is bariatric surgeons have spent a lot of time to be very, very precise with what we do, and also to be very, very meticulous about following up our patients. So hopefully you won't ever see any of this because most patients don't. But if something were to go wrong, the way you prevent it from getting out of control is by jumping on it very quickly, right? By correcting problems fast. And so we don't take anything for granted. We don't dismiss any complaint. And if there's something that you think is wrong, we want to know about it. And we want to make sure we look into it to make sure there's not a problem that needs to be fixed. It's much easier to fix a problem within hours than it is to fix it days or weeks down the road.
Yeah. No, go ahead, Christina. Sure.
Well, okay. So for me, a person who's not really familiar, I've heard the terminology and what some of the different weight loss surgeries are called, but I don't know exactly, like when you say gastric sleeve by surgery, like what does that mean exactly? Like what happens? Is there an actual sleeve that is put around your stomach, or what exactly is that?
So that's a great question. Yeah, I think a lot of people think that the sleeve is like a prosthetic device. So what sleeve refers to is sort of the configuration that the stomach takes. So if you look at the stomach, and I wish I would have thought of this, I could have brought pictures. But if you look at the stomach, it's sort of shaped like a J. So it's big and it kind of comes down and curves. And most of the extra volume in the stomach, kind of where Thanksgiving dinner sits, is the top half of the stomach. So when you eat a big meal, a lot of the food sits in the top back of the stomach called the fundus and slowly processes through the stomach. And that's why you feel full for a couple hours after eating a really big meal. With a sleeve gastrectomy, what we do is we basically remove that top portion of the stomach and make it a very narrow tube. So you're only left with a small pouch at the bottom of the stomach. So you don't have the capacity to eat large meals. You can still eat, food still goes through the esophagus, the food tube that connects your mouth to the stomach, and then through that little sleeve section of the stomach into the little pouch at the bottom. And so, a 4 to 6 ounce meal will make you feel full as opposed to, being able to eat Thanksgiving dinner. So the sleeve really refers to the shape of the stomach when the operation is done. The gastric bypass, which is the other commonly done operation these days, actually creates a little pouch at the very top of the stomach. And so we cut the stomach into two pieces, a small piece at the very top that's connected to your mouth, and then a bigger bottom portion of the stomach, that sort of Thanksgiving portion of your stomach, that's no longer connected to your mouth. So food can't get into that part of the stomach. Now, to get the food into your intestines, we obviously can't leave those two disconnected completely. So we bring a piece of intestine up from lower in the intestinal tract and connect it to the small pouch of stomach. That allows food to go into the small pouch. You feel satisfied and full, again, after 4 to 6 ounces of food. And then the food will transition into the small intestine, and it bypasses the rest of the stomach and the beginning part of the small intestine called the duodenum and the jejunum. And by bypassing those sections of intestine, we change a lot of the hormones that the gut produces that do things like cause you to feel full, cause you to feel hungry, cause you to have cravings. And by changing those hormones, we really change the way that you interact or relate to food. And so, we used to think of these as very mechanical operations, but probably the most important things that the operations do now are change the hormones that your gut produces so that feedback to the brain changes and the desire to eat and the desire of what to eat changes. So it's really, we define obesity as a metabolic disease and a neurobehavioral disease. And so really what we're changing are the hormones and the nerves in the intestines to change the way people perceive food and interact with food.
And the latter part that he described is what I'm going to be getting. So she's like, oh my goodness.
Okay. No, this is great information because you've been, researching this obviously, Gail, and, you're going through all the classes, but I mean, I know a few people over the years who've had it, but I, didn't get into detail about what exactly happens during the surgery and how does it change your stomach. So that's it's fascinating.
Oh, yes. And Dr. Catania has a huge following. I'm telling you, I even have some people who are just like, when they found out that Dr. Catania was going to be on my show, they're like, when is the show going to be on? What? These are people who are going to be patients. And also it's interesting because I also was going through with taking, when you're taking medication and such, Dr. Sylvia Horsley, who I just adore. And now that her practice is closed, everybody, I had no problem telling them that I am going to Dr. Catania. So they were all like, where are you going? Who? So maybe I'm going to discount on that. Just wondering.
Yeah, there we go, right? the friends
referrals.
So
it's actually, so one of the things we're trying to do at our center is to build a, really inclusive, really all hands on deck weight management center, right? Because it's not just the surgery, it's not just the medicine, it's not just the dietitians, it's not just the behavioral health people, it's everybody together, right? And so we really believe that kind of all-encompassing model will give our patients, regardless whether they want surgery, they want medicine, they just want counseling, the best options. And also, as you may have noticed over the years, right, people's ideas on what they need change. Obesity is defined as a chronic progressive disease. And so unfortunately, we haven't come up with a cure for obesity yet, right? So you never cure it, you just treat it. And some people can do really well with treatment for years and maintain a stable weight for years. And then something will happen and that obesity will sort of stir again. And so particularly with women, very common to see menopause cause a significant amount of weight gain, right? And so a lot of our patients, they're dieting and exercising and maintaining a healthy weight until they hit menopause, and then they gain weight and they're unable to control it any longer with those old techniques. And maybe they add medication for a while, and maybe that puts it off for, keeps it under control for another couple of years. And then maybe at some point they progress to the point where they need surgery. And so we want to be able to give patients whatever it is they need and whatever it is they want to keep their weight healthy.
Is it also fair to say, I know we have a few more minutes, but is it also fair to say that COVID also plays a big part of that as well? Because you have an active lifestyle, you went into shutdown mode, and then all of a sudden your eating and mental behavior has changed, and you just can't get it back on track again. Myself like that, yeah.
We saw a tremendous amount of weight gain. In fact, the whole country did. If you look at the statistics, I think obesity rates jumped about 3% in the time of COVID. And there are a lot of reasons. One was, activity stopped. So people who used to go outside and do exercise weren't able to do that anymore. Another was, it was scary, right? And stress causes a stress reaction, and a lot of cortisol is released. Cortisol makes you hungry, right? And so people ate a lot more during COVID. Cooking was something that was fun to do, and you didn't have many fun things you could do in your house. So people turned to cooking and food to make themselves feel better. Alcohol consumption went way up during COVID. And so a lot of people started drinking a lot more alcohol than they had in the past. I think because they were home, they didn't have to travel. There was no worry about drinking and driving, so that became a lot easier to do. So there are a lot of reasons that COVID caused a lot of people to gain weight. And it has been very hard for many of them to dial that back.
You just to touch on that real quick, you made a great point, because you also say for people who are having the surgery to be careful, because alcohol can also play a very big, like a devil's advocate for what they didn't have wasn't a problem before, but it can be, and they didn't realize it. And that's a sneaky part. Would you like to add?
Yeah. So, alcohol consumption can go up in some patients after weight loss surgery. You actually respond to alcohol differently. You absorb it much more quickly, and so you become much more intoxicated from alcohol. And so we definitely warn our patients for two things. One is, alcohol is a carbohydrate, and it's not a great thing to consume if you want to lose weight. Now, it doesn't mean you can't have a drink, right? It's, having one drink with friends is part of being an adult, right? It's fun. And so I'm not saying people shouldn't have alcohol, but getting into the habit of having one or two alcoholic beverages a day can cause weight gain. And in patients with weight loss surgery, because they metabolize it differently, that can lead to 3 or 4. And next thing you know, people can develop alcohol problems. And so we like to be very upfront about that, to discuss it before we get to surgery, so that people know that's a potential issue. And then we are very, very careful about monitoring patients afterwards, so that if it does look like it starts to become a problem, we intervene right away.
That's good to know. So see everybody partying, I'll be like, so Christina, just see, can't go out to the partying with you. So
Right, right.
no, this is all great information. And I think that I know we're gonna have to do like a part 2 with you, Dr. Catania, because there's so much information here. And I know even talking about the recovery, what that is gonna look like, and how for some of the patients, what does the success look like for them after they've had this type of surgery? I know for myself, I'm looking forward to not only for the waistline, of course, but also for the migraines that I've been a sufferer since I've been 9 years old, and also for an eroded hiatal hernia that I've been also suffering with. So those are 2 medical conditions that I can't wait to see, change. But real quick, if we could, talking about the recovery afterwards, looking at the 2 weeks, what are some of the do's and don'ts that you tell patients after their surgery?
So after surgery, first, be prepared for some discomfort. It's not like open surgery in the days 15, 20 years ago, where people were stuck in bed for days after surgery and on high doses of narcotics just to be able to breathe. So it's better than what it was historically, but it's, I'm still poking a bunch of holes in your belly, and that does hurt. You do want to be up and moving as quickly as possible. We have all our patients walking within a few hours of surgery, so you'll be getting up and going to the bathroom yourself, walking around the floors with the help of the nurses. We do want you to be sipping on liquids and sort of getting used to what it feels like to drink again. We don't want you to lay in bed all day. We don't want you to take shallow breaths and not, challenge your lungs to keep them open. And so we'll have you up and about. There's a very specific post-operative diet that we'll ask you to follow. And that, is basically a liquid diet for the first 2 weeks after surgery. It's real important that people follow that. Very rarely, thankfully, do we see complications after surgery. But one good way to bring on a complication is to kind of jump the gun and try to eat something too quickly. Because, that surgery involves staples on the stomach. It involves stitches in the stomach. And we don't want to put any undue pressure on those while they're healing.
Right.
A couple of months after surgery, once everything's healed, there's very little that can go wrong. But for the first couple of weeks, those mechanical devices that are helping to hold things together can be overcome if you say don't follow the rules. And so, but we'll be there with you the whole time, giving you advice. And everybody makes a mistake, so nobody's going to yell if anyone does something wrong. But we will explain to you why we do the things we do the way we do them, because it really is what gets patients through most safely.
Absolutely. The only one who would be yelling would be me if I did it wrong. I'd be like, oh,
everybody always has their one moment where, and part of it is just, lifetime of habits are hard to overcome in a day, right? It's hard to turn off some of the behaviors that you've been accustomed to. And so we see it all the time. People, are doing well for weeks or even months, and then all of a sudden, something happens and they fall back into an old pattern, and then, a problem develops. Usually those are very self-limited problems, and you feel bad for an hour or two.
yes.
But they're also learning lessons.
Well, I got my
Well,
squad. Believe me,
yeah.
Christine will be on top of me, and I've got my neighbors
Yes.
chained up and like,
It,
listen to him.
yeah. Well, and I mean, it all makes sense why people have to do so much studying and preparation beforehand, and maybe the start of habit changing, or at least education about the habit changings and that, or habit forming new habits, because then afterwards, what you just said, that makes so much sense. So they have at least the education and the knowledge. And then support teams or support groups, or maybe support, with family, friends. And do you guys even have support groups that you offer that people can be a part of? So, others going through the same thing. I'm sure that's probably helpful too, right?
Yeah, we absolutely do. And so, right, I can talk about this all day because I've been doing it for years, but I've not experienced it personally. So I can't, tell you what it's like to go through the surgery. But another patient can. And so support groups are really important. And so we do encourage our patients to come to support groups. We have them over in the office. And sometimes we get preoperative patients, sometimes we get postoperative patients, sometimes people are a few days out from surgery, sometimes they're many years out from surgery. So you can really learn from all of the above. And but it's a really, really important point that you bring up, because we do feel like your best helper is going to be someone who's been through it before and can offer you that real world experience of what happened to them and how they were able to adapt and overcome those challenges.
Absolutely. I know I've had some people who have already reached out who have been patients of yours and just scream, you're just amazing. You really are thorough. I'm one.
Blush now, Gail.
You're a rock star that we're going to be looking at. You're a real entertainment rock star here. I'm just so blessed and honored to have you just taking care of me and your staff. I can't say enough about you and your staff. There is a big difference, because when you are going to do something this life-changing and altering, it makes sense. And it just started from, as I said, when I saw Kelly Osborne, and then started doing my own research and getting on the phone, and then meeting such a caring staff. And that is the key, because some could be afraid, some are uneducated. And I don't mean that in a mean way. I'm saying educate yourself, know what you're up against. This is the team. Dr. Catania and his team is the one to help you through this. And they literally hold your hand. You might feel like you're going to give up. You won't give up. You won't give up. I can't wait to share my results with you. And then we're going to have Dr. Catania back to talk about that, because there is so much more. So, Dr. Catania, I cannot thank you enough for spending the time with us. And we would like to have you back as a part 2, if we could, because I think it would make sense in the process.
Oh, absolutely. I think it would really be helpful for, other people who are considering this journey to see, what you've gone through beforehand, what it's like early after surgery, because it's tough. There's no two ways about it. And it's okay to get on and be struggling a little bit. And then, how you feel a year or 2 or 3 down the road, because really that's when people come back and say, what a life-changing event it was. And how much more they're able to enjoy life after achieving that weight loss, and then having some of those other medical problems that you pointed out improve as well.
Absolutely. I want to thank again Dr. Catania, my surgeon, who is going to be performing my surgery. And again, you can check out the caring staff over at Southern New Hampshire Health and Weight Management, located at 29 Northwest Boulevard in Nashua, New Hampshire. I will be posting that on my Facebook. We'll have the links and all the information. And Dr. Catania, again, I can't thank you enough for spending the time with me, and Christina, because this has been educational, but I'm super, super excited. June 1st. Woo, woo, woo. I cannot wait. Woo,
Yes.
I cannot wait. This is going to be amazing. For Gail Scott Keyes Entertainment Now, with my co-host Christina Millsaps, with Dr. Catania, it has been amazing, and we will see you next time.